I think it's worth having some consideration about IV infusions. For years we've been making them up at ward level, and what we didn't realise was how inaccurate some of those syringes were for making continuous infusions. And in fact, some of the studies have shown that for 68% of all syringes, they're outside of a 7.5% accuracy on terms of what they should be. 28% are more than 20% wrong. Now, if any other medicine was that inaccurate, we wouldn't use it, and yet we're using these all the time without knowing it, and therefore we don't know whether the patient's actually getting better or worse, because we don't know whether the medicine we're putting in is far less than we thought it was, or far more. Therefore, it's time to move on, and we're trying to look at that through standardisation. In a way, the same as adults have done. Adults tend to consider that all adults are roughly the same size, and therefore they have 1 or 2 concentrations. We've worked out that for most drugs, we only probably need about 5 concentrations to do the whole of the paediatric population, right the way down to 0.5 kilo neonates. So it is possible, but it's complex, and we do need to think about who's going to manufacture them, who's going to do all the programming in the smart pumps, which make it easier to do. Of course, all of this can be done by hand, and even making up standard concentrations by hand has been shown to be more accurate than using sort of the individual weights to do them. But ideally, we get to a point where the syringe pumps are all programmed correctly, smart pumps, and the syringes come ready-made. It is time to improve IV administration for paediatrics.